Okay, welcome everybody again. This is Debbie Stein, Network Director for the Partnership for America's Children. Our webinar today is on Within Our Reach, Steps Forward. It's about the work of the Commission to End Child Abuse and Neglect Fatalities. We have two speakers today, and I'm going to go ahead and introduce them for you. The first one is Amy Harfeld. Amy is the National Policy Director and Senior Staff Attorney for the Children's Advocacy Institute. The Children's Advocacy Institute is a partnership member, and it's based at the University of San Diego School of Law. Amy represents CAI before federal policymakers in Washington, and she also advances CAI's national policy agenda independently and within the National Child Abuse Coalition, the National Foster Care Coalition, and other advocacy collectives. She's been an advocate, educator, and public interest attorney for over 20 years. When she got out of law school, she litigated child abuse and neglect cases for New York City's Administration for Child Services. She founded a legal services program for incarcerated parents, and she served as the executive director of First Star, a child welfare organization in Washington, D.C. Our other speaker is Amy Templeman. She directs the Within Our Reach office at the Alliance for Strong Families and Communities. That office is the key organizer to promote the work of the U.S. Commission to Eliminate Child Abuse and Neglect Fatalities, and Amy was the executive director of the Federal Commission. Amy previously managed the D.C. Child and Family Services Agency. She worked for the Center for Adolescent Health at the Johns Hopkins Bloomberg School of Public Health. She served as a project manager in the Peace Corps in Malawi, and she conducted child welfare research for the Urban Institute. So you can see we have two really knowledgeable and expert people today, and I'm happy to be able to have them educate you about the work of the Commission. We're going to start with Amy Harfeld.
Good afternoon, everyone. Can you all hear me? Excellent. Well, welcome everyone, and thank you for joining us on this Tuesday afternoon. I am going to, Debbie just already introduced us, and I thank you for the warm introductions, and I want to thank you for the chance to do this webinar. We really think that this work is critical at all levels, but that state advocates play a unique role in helping to advance this work and this issue, and haven't really been as much of the conversation as we would have liked. So we really appreciate the opportunity to speak with all of you and to see the best way to incorporate some of this work into your work. So the goals for today, firstly, we'd like to just review a little bit of history of the Federal Commission to Eliminate Child Abuse and Neglect Fatalities, a little bit about who they were and what they found and what they recommended, sort of from the forest perspective. Number two, we'd like to talk about some of the initial activity that's already occurred since they wrapped up their work in March 2017. There has been, I think, more activity than we would have suspected at the state level, and some activity at the federal level already to implement the recommendations of the Commission. And 3 and 4 sort of work together. We'd like to talk about what might be possible in the months and years ahead to further advance the work of the Commission and, more importantly, the issue of child abuse and neglect fatalities and near fatalities more generally. And so, part of this is informational, but really we'd like to end the webinar by trying to start engaging with you about what do you think is possible and what role do you think you might be interested in playing in the work moving forward, and to sort of get folks thinking about what the possibilities are for state advocates and how we can move the work forward. So moving on to the brief history, some of you might be more familiar with this work than others, but the Federal Commission to Eliminate Child Abuse and Neglect Fatalities was established by an act of Congress, the Protect Our Kids Act of 2012. At that time, Senator John Kerry was actually one of the primary champions of it. And quite a number of federal advocacy organizations worked very hard for years to highlight the issue of fatalities, which throughout the years have remained fairly steady. And although really the worst outcome in child welfare, there's not a whole lot of attention that's been paid specifically to fatalities. And so the work of these groups in the Protect Our Kids Act was to explicitly establish a federal commission that would work for 2 years to go into this in depth. I'm going to move along. So the Protect Our Kids Act, which established the commission, basically stated that a bipartisan federal commission, 6 of the members were appointed by the White House and 6 were appointed by Congress. And they really ran the spectrum of experience and political views and backgrounds. It was a very diverse commission. And they were charged with doing the following: looking at how child protective services and child welfare services are funded in various acts under the Social Security Act and other federal legislation, to examine the effectiveness of child protective services as it pertains to child abuse and neglect fatalities and near fatalities, to identify best practices in preventing fatalities, and to the effectiveness of federal, state, and local policies insofar as they are collecting data on fatalities in a coordinated fashion, sort of between states, federally, sort of at all levels. They also looked really carefully at what are the barriers to preventing fatalities, what are the trends in demographic and other factors that are correlated with child maltreatment that often result in fatalities. They looked at how to prioritize prevention for families that seem to have the highest need or where fatalities seem to occur with greater frequency, and generally looked at, how can data collection and better information really be used as a tool ultimately towards prevention. So the commission served for a period of 2 years, and they met all over the country. They had 10 public meetings, one focusing on tribal issues, one focusing on research. They had many deliberations over the phone and a meeting here in D.C., et cetera. And they heard from, they received written testimony from many organizations sort of along the spectrum, and also met with a diverse array of stakeholders over those 2 years. Their final report was released in March of 2016. So it's been a little over a year since they put out their report. And what they did in their report is they sort of highlighted some findings. So just sort of a real top view of what do we know about fatalities and how and what causes them and where they are most prevalent. So that's what I'm going to go over now for just a moment. So the number one sort of highlights of the key findings and that there are populations in need of special attention. It became quite clear that infants and toddlers were at higher risk of abuse and neglect fatalities compared to other age groups. And we did know this. This has been, statistically clear from federal data over many years, but it was certainly confirmed and validated by all of the data that the Commission heard over their 2-year tenure. We learned or confirmed that deaths among American Indian, Alaska Native, and African American children are significantly overrepresented in fatalities as compared to their population, their proportion in the nation's population, generally speaking. Again, not shocking, but concerning and consistent with what we thought we knew before. The research on risk factors was interesting. What we learned in terms of who might be most vulnerable to fatalities, these are the factors that were identified as creating the greatest risks: social isolation, young parents or single parents, caretakers, and parents who struggle with mental health issues, substance abuse disorders, as of course we're seeing really increasing amounts of now, and domestic violence, a dearth of parenting skills. And, again, we knew this, but it was confirmed, poverty itself really is not causational, but it puts strains on parents that can elevate stress and increase risk. Some other of the key findings of the Commission, and this I think is really important to highlight because I think it's really actionable at a number of levels. A call to CPS, regardless of the disposition, is the single best, most accurate predictor of a later child abuse or neglect fatality. And that I don't know if we knew. And it's really interesting, and because 40% of calls to CPS nationally are screened out and not investigated any further. And of course, screening out cases leaves children at a higher risk for later fatality. So this seems to be a very fertile area to look at later on. They found that the involvement of healthcare and public health agencies and professionals were vital to safety for children, and that well-coordinated interagency efforts were essential for child safety. They found that the importance of CPS workers' access to real-time information about families cannot be overestimated. And by real-time information, sort of a general term for our agencies sharing information with each other as it pertains to a history of family members or household members that could relate to child safety in some way or to past involvement with CPS or the criminal justice system or other systems that would be relevant to a CPS worker's good decision making.
So we're going to take a moment here and ask all of you a question. If you could click on the screen, either yes or no, we're going to get answers from you and then we'll look at the results. So if you could just take a moment to do that. Okay, we've had 9 respondents, and if anyone else wants to, we're going to give you one more moment, then we'll look at the results. Okay, you should see the results on your screen. Amy, over to you.
Fascinating. Yes, I love it. So it seems that a majority of you don't feel that you have sufficient transparency or data available on fatalities in your jurisdiction, which doesn't shock me, but I'm glad to see that a few of you do feel that you have access to good information on it. So some additional findings of the Commission, which were really highlighted in the report, is that we don't have good data nationally, and that accurate national counts allow us to begin to understand what works and what doesn't work. And frankly, it helps to quantify the problem accurately in order to make a credible demand for funding for the problem. So for example, federal data usually shows that there are approximately 1,500 fatalities a year from child abuse and neglect. But the Commission found that that number is a drastic undercount and is probably twice as high as that, and some people believe that it could be about 3 times that. And so in order to quantify the problem and make a demand for resources or prevention services or to implement a lot of the recommendations, it's really important to have accurate data on quantifying the problem. Another, okay, well, I'll move on. The nurse, so most of you probably know this, but of course over 2 years, the Commission looked really carefully at what programs are working and which ones are not working and which ones have actually resulted in data and scientific proof, right, that they reduce fatalities or that they help to address the issue of fatalities or near fatalities. And the only program that really came to light as being a tried and true evidence-based program is the Nurse-Family Partnership. And so I think they got some due props in the report, and I'm sure many of you can testify to their effectiveness at the state level. So those were some of the key findings of the Commission. The recommendations of the Commission were pretty far-reaching. There were 114 recommendations in the Within Our Reach report, and they really focused on incorporating all of these recommendations on child fatality prevention into the concept of a 21st century child welfare system that's based on a public health approach, which is a little bit different framework for looking at the issue than we have previously. So you'll see a chart here And it sort of encompasses the thinking of the commission and sort of where they came at the end of their 2 years. It's called Core Components of the 21st Century Child Welfare System Require Public Health Approach. And we have 3 factors that go into that public health approach to child welfare. We have decisions grounded in better data and research, multidisciplinary support for families, and system leadership and accountability. And at the center of this, all of those elements revolve around this concept of a shared family and community responsibility to protect children. And I think, part of the focus on that is a recognition that CPS is not the be-all and end-all of child welfare, that efforts to prevent child abuse and neglect generally and fatalities specifically are a community effort, and that there are lots of eyes on children and families, and that many different entities, professionals, neighbors, family members have a role in keeping kids safe, and everybody has a part to play. The decisions grounded in better data and research focus on what we just spoke about previously. We really can't do the work that needs to be done if we don't have good data and information on the extent of the problem, and not just the numbers of fatalities and near fatalities, but what is it that's causing fatalities? Is it children being returned home too soon after they're being removed? Is it that removals aren't being done when they should be? Is it that preventive services weren't available when they should have been referred? Is it that CPS workers' caseloads have become unmanageable? Is it a funding issue? Is it a workforce issue? Is it a legislative issue or policy issue? I mean, there's so many different reasons there. But unless we have good data on what happened with each child and each family and the history of that child and family, it's really hard to identify the solution. Multidisciplinary support for families has to do with the fact that, again, it's not just CPS. Multidisciplinary support for families could relate to child advocacy centers. It could relate to other professionals outside of CPS that have hands or eyes on a case, or members of that family. System leadership and accountability has to do with the role that legislators play in enacting policy reforms, legislative reforms, providing funding that is necessary to not only to carry out current law, but to enact important future legislative reforms and programmatic fidelity. And accountability, there was a finding again and again and again by the Commission that there is insufficient accountability at all levels across child welfare, that the laws that are on the books are actually not being enforced, and that, because of a combination of a recognition that states are underfunded and local systems are underfunded, and that the laws are sometimes unrealistic, there has been sort of a status reached that states are not totally expected to do everything that's in the law, which really shouldn't be the case, and that we need to find a better balance between what's in the law, what's expected of states, what they're able to do, what they're claiming they're able to do, and just a more better integrity with child welfare enforcement generally. Okay, moving along. Recommendations. So again, there were 114 recommendations of the Commission. If you look at the report itself, the link to the report was provided in slide 16. So if you actually want to go online and download the full report, you can see a link to it there. The recommendations are scattered throughout the report, but I have pulled them all together into one consolidated document, which Deb is going to share with all of you at the end of this, at the culmination of this presentation. So you can sort of see all 114 of them, but we wanted to elevate and sort of highlight for you the top 10 recommendations that the Commission itself highlighted in their work. First, was a recommendation. The number one recommendation from the Commission was every state should be required to develop and implement a comprehensive state plan to prevent child abuse and neglect fatalities. Federal prevention efforts are super important, and probably the majority of fatalities occur for similar reasons across states, but there are also a lot of unique circumstances and features of fatalities in states, and every state, has unique circumstances that need to be considered in terms of their own fatality rates, trends, et cetera, and that each state should have their own independent fatality prevention plan. Number 2 relates to that. States should undertake a retrospective review of child abuse and neglect fatalities from the previous 5 years, with one group of commissioners supporting a $1 billion increase to CAPTA to fundamentally reform the child welfare system. So, I put these together to some extent that the fatality prevention plans should be based on a retrospective review of fatality data from the last 5 years so that prevention can be based on what states have seen happen in the most recent years. The issue of funding was a very interesting one for the Commission, and probably some of you are not surprised at the outcome. The Commission uniformly agreed that federal child welfare funding needs to be enhanced, but there was some disagreement about exactly how much more money is needed to sufficiently fund current federal child welfare programs. Some commissioners had a variety of different views on exactly how much was needed, with some commissioners concluding that they couldn't articulate exactly how much was needed. But there was one group that said that at the very least as a starting point, we should have a $1 billion infusion to CAPTA funding to reform the system. Now, for those of you who don't know, that's a big deal because CAPTA is currently funded to provide $25 million of state grants a year. So if you infuse $1 billion into a federal program that's currently funded at a total of about $95 million with state grants at $25 million, it makes a pretty powerful statement about how anemic the current funding level is. Number 3, every state should review their policies on screening reports of abuse and neglect to ensure that children most at risk receive appropriate responses. And we discussed that in the previous slide. Again, it was identified as a very fertile area for reform. Number 4, the administration should lead an initiative to support the sharing of real-time information among key partners such as CPS and law enforcement. All of you already know why that's so important. I think there was some surprise during these meetings that there was no information available between law enforcement and CPS, and that although some jurisdictions had good programs underway, in most areas, there really was no such thing and no way for CPS to know the criminal histories or involvement of relevant members in a family, and the same thing for law enforcement having good CPS histories. Number 5, existing child death review teams should also review life-threatening injuries. Some of you know them as near fatalities caused by maltreatment, and some already do, but it's not a uniform thing that death review teams take a look at all at near fatalities or life-threatening injuries. Number 6, all other federal programs such as Medicaid and home visiting should be held accountable for ensuring their services reduce abuse and neglect fatalities. Should be an articulated goal in federal programs that are aimed at child safety. Number 7, there's a need for a minimum standard designating which professionals should be mandatory reporters of abuse or neglect. And for mandatory reporters who do need to maintain licenses and have ongoing continuing education, that training and competency should be a condition for licensure. And as a former teacher, my experience is that I was given a brief training once and then it was never repeated. And so I think the idea here is that it's an ongoing thing. It's not a one and done process. And that mandatory reporters is not just a classification, but rather there should be actual standards that are understood by those who are reporters and those who are not, to really have a clearer sense of what's required of those professionals. Number 8, there was a recommendation to elevate the U.S. Department of Health and Human Services to report directly to the Secretary of HHS, which might seem sort of random, but it was interesting to learn throughout the deliberations that used to be the case. It used to be a direct report either to the Secretary or to the President. I think it was a direct report to the President. But regardless, at this point, many of you know that the Children's Bureau is buried a number of layers down in the bureaucracy of HHS, and as a result doesn't always receive the profile that we believe the issue of child welfare deserves. Number 9, Congress should hold hearings on safety, provide resources, and encourage innovation. The congressional jurisdictions over child welfare are diverse and usually don't speak to each other. Title 4E jurisdiction is different from CAPTA jurisdiction. And although the programs are complementary, the committees who decide those things really are not coordinating their efforts with each other, which was determined as extremely important in developing a national strategy that's coordinated and coherent and consistent, et cetera. Resources, as everyone knows, is important for everyone. And always an issue at the federal and state levels. And encourage innovation, which frankly is an area where we've seen more activity, which I'll go over later, but there has been quite a lot of interesting innovation. Number 10, although all commissioners recommended more robust funding, there was disagreement about precisely how much. I already mentioned that. There was an agreement that Congress should continue to support flexible funding and a pretty specific shout out for a continuation of the waiver program, which may or may not happen. Number 11, improve and support data collection about child abuse and neglect fatalities of American Indian and Alaskan Native children. For a number of really interesting reasons, we have even worse information and less reliable and comprehensive data about those communities, rates of fatalities and near fatalities than in the general population. And so we really need to focus on getting better numbers there so we can designate appropriate resources to prevention efforts. And number 12, we need to conduct pilot studies of place-based intact family courts in communities with disproportionate numbers of African American child maltreatment fatalities. And a lot of folks don't really understand what these are, but place-based intact family courts, which I'm not an expert on, really try to focus on strengths in a family. What's going right? What are the factors that are keeping families together? What are the factors that are helping to keep kids safe in a family? And to really focus on what's going right and what can be and what can be strengthened in order to ensure continued safety in a family, rather than simply responding reactively after something bad happens. I'm sure I didn't do that justice, but that was my quick summary. So, Deb, we have another poll here.
Yeah, so if everybody would take a minute to answer this poll, and then we'll look at the results. And while we do that, I also want to remind you all that we do have that chat function in the bottom left part of your screen, and if you have questions or comments, you can send them to, I'd ask you to send it to all co-presenters actually, and then we can answer them at the end of the presentation. This way your thoughts are captured while they're fresh, and we'll be able to make sure that we answer your questions or react to your comments. So we've got 8 people. I think probably a few more people are interested in responding to this question, and let's just give it another moment or two. Okay, I guess that's it. Oh, 11. Still climbing here. Okay, let's see what our results are here. Over to you, Amy.
And we tried not to confuse you all too much, but we have 2 Amy's here, so the Amy Templeman is going to take over now.
Thank you, Amy Harfeld, and thanks, Deb. It's really encouraging to see the number of you who are familiar with the Commission's work, because my job is to talk about implementation. So if you were familiar with the Commission, then you will probably be happy to hear about the many implementation activities that we've been tracking over the last year, and you might also know about some implementation activities that we don't know about yet. So one of the purposes of the webinar today is to show you how we've been tracking this information, and then also how you can submit any additional information that you might have. I have had the privilege of working with the Children's Advocacy Institute for the last year and a half now on doing this work to promote the findings and the recommendations that came out of the Federal Commission. And one of the first things that we did was set up a couple of tools so that we could be alerted to practice and policy changes happening across the country with a big focus on the states, but then also looking at some of the federal changes that have come up since then that are consistent with the Commission's strategy. So what you see in front of you right now is an online map, and this is actually a draft website that has not gone live yet. And it's also a little bit outdated. You see some states highlighted in blue and some cities and counties highlighted with squares. When the website does go live, there will be a lot more states filled in, because what we've been able to do is a national survey. We surveyed the child welfare director in every state, and then we also surveyed the child welfare director in every county for the states that are county administered. And we received a really high response rate, and we've been able to pick up some information about the states that didn't respond through the news. So when the website goes live, which will probably happen sometime around September, we're thinking, you will see a lot more information there. But in the meantime, if you start hearing of anything related to implementation of some of the recommendations that we've gone through today, we'll be sharing our contact information later in the webinar, and we would definitely want to hear from you. A second feature of the website once it launches is that it will have details on all of the federal government implementation activities, what the states and counties are doing, and then what other national organizations have been doing. The Children's Advocacy Institute and the Alliance and the Within Our Reach office are not the only organizations who are working to promote the work of the Federal Commission. There are many different organizations who have partnered with us to do that, and we've been tracking their efforts, and that will be included on the website as well. As you do come across any sort of implementation updates or activities that you think we would want to know about, under the section titled Submit Updates, you will have the ability to go in and give us a summary or the name of the contact person who might know more related to the activities that you've seen, either within your organization or within your state, or even federal activities that you think are closely linked. Another tool that will be helpful for all of you as an advocacy community will be our stakeholder toolkit. This is a toolkit where we have sample social media posts, we have a lot of different marketing and communications tools that came out of the Commission's work. Unlike some previous national commissions, we didn't have time as a federal entity to do a big rollout of the report. The report was released 2 days before the Commission ended its operations, but we did have time to produce some of the tools, and then through this website we'll be able to share them with the broader community, and hopefully they'll be helpful to you. I did want to go briefly through some of the federal implementation activities, and I won't read all of these, but just to hit some of the highlights and the ones that I think you all might be most interested in. We were very happy to receive news when the Department of Health and Human Services published its response report, which they were congressionally mandated to do within 6 months of the Federal Commission report coming out, that they were committed to advancing 60% of what the Commission called for from that department. And some of those things were already in progress even before the Commission came together or during the Commission's time, and then some of those were new commitments that were in direct response to the Commission report. There's also a real opportunity here, I think, around maternal depression screening and treatment. And there's a Commission recommendation that's really specific about this opportunity during an EPSDT screened for depression and linked with treatment if needed. And there was some guidance that came out in May that spoke to this issue and said that mothers would be eligible during an EPSDT visit to have this screening done. And so far we've been able to track about 12 states that have taken advantage of that opportunity based on the guidance. So a lot of other states have not been able to do much, or might have plans to, but have not implemented the benefit based on this guidance. There was also a White House foster care and technology hackathon. There were actually several of them that happened mostly in 2016, 2015 as well, that really looked at how to share information, especially in real time across systems. It was a large grant announced by the Department of Justice that currently seems to be either on hold or it was canceled. We haven't been able to get a word on its status, but it was a grant to eliminate child fatalities through strategic partnerships, and it was to be a $5 million grant to build on partnerships and to develop a data-driven approach to address fatalities. Some of the other federal updates include last summer, President Obama signed into law the Comprehensive Addiction and Recovery Act, which was really a big step forward in terms of how to address the opioid epidemic, and it included 6 pillars for a coordinated response to the epidemic. It covered prevention, treatment, recovery, law enforcement, criminal justice, and overdose reversal. And the other thing that it did was it changed the language that used to include only illegal substances to include legal substances. So that would include painkillers and alcohol and any other legal substances that didn't used to be a part of that legislation. Also at the federal level, many of you have probably closely followed the Family First Prevention Services Act that was introduced again in our current Congress and would open up those $40 for more preventative services. And as Amy said earlier, the funding flexibility that would be envisioned through that act was something that the Commission endorsed. There are 2 pieces of legislation that are either overdue or due for reauthorization, and that would include CAPTA and MCV. I understand tomorrow is a day of action around MCV, making sure that home visiting programs are really supported as much as they can be. And as Amy said, the Commission found that specifically the Nurse-Family Partnership Program showed evidence around preventing fatalities, but there are actually 19 federally funded home visiting programs that show evidence around child abuse and neglect prevention. So definitely something that the Commission endorsed supporting. Some of the news that we wanted to point out to you comes from states and counties. And this slide says that more than 40 jurisdictions are implementing activities, but since we've done the survey, we now know that this number is much higher. And when the progress report comes out in September, you will have a more updated list of who's doing what and how the different states compare with each other. One of the most exciting initiatives materialized last summer. The National Governors Association and the National Conference of State Legislators, along with Casey Family Programs, got together and designed a new 3-branch institute. And this one is focused on improving child safety and preventing child fatalities. 8 states that are listed here signed on to that institute, and their engagement is coming to a close. They will be releasing their fatality prevention plans in December of this year and then beginning the implementation of them. There are a variety of different issues that the states are committing to and different draft legislation they're writing and different practice and policy changes. They are really focused on looking at safe sleep, looking at substance use disorders and treatment. They're looking at baby boxes to some extent as one option for a safe sleep environment. They're also looking at data sharing across systems and really making sure that their judicial branches are included and are really signing off on this work and supporting it. There are also 7 states, and I believe some others are interested in implementing a program called Rapid Safety Feedback, which is a way of conducting analytics in real time to be able to flag those high-risk cases for more intensive monitoring and then also coaching from the supervisors. I'm going to go pretty quickly through the next slides because I want to make sure that we have enough time for questions. California has a lot of work happening around implementation related to the Commission's work. San Diego and Los Angeles County are two of the examples. Monterey County is also a third. But LA has really taken the lead on doing a deep review of the last 5 years of their data to figure out what are the risk factors, and that's very much in line with what the Commission called for before the Fatality Prevention Plan is put into place, looking closely at the data, understanding what it says, and then coming up with a plan that addresses those trends that they've seen over time. Indiana was the first state that we knew about to sign on to the screening recommendation for younger children. Last summer they changed their assessment policy statewide so that now any child under the age of 3 receives an assessment for any report of child abuse or neglect. And then also that's followed up by support from a home visiting program. So it's been about a year now since they implemented that change, and I think it'll be really educational for us to look at how that's going for them, and as they start to evaluate that policy change, understand what it has meant for them and also any budgetary implications that it might have had. There are a variety of different pieces of legislation that have been introduced in the states. I think some of them have been around the workforce, as in the one here, the last one in New York, and some of the others directly related to opioids. And in the progress report, we will try our best to report on the status of each of those pieces of legislation and also any commonalities across states. Ohio has a really big initiative that they started about 6 or 9 months ago, I believe. The Attorney General's office put out a brand new program across the state to train all of the doctors and nurses at 19 of their hospitals on how to screen for signs of child abuse in really small babies. So they're looking at infants 6 months and younger, and it was signed into law around the same time as a new safe haven law so that parents understand their options if they need to surrender newborns. And so these two things are going hand in hand, and a new strategy throughout Ohio to make sure that infants are better protected and that also parents are receiving the supports that they need. The screening initiative at the hospitals goes hand in hand with some wraparound services for the families depending on what is produced and found through the screening process. And then finally, Texas was the very first state that we knew about last summer to release a 5-year strategic plan to prevent child maltreatment fatalities. And it's a multidisciplinary plan. Their pediatricians were heavily involved in writing it. And we were hoping that other states start to pick up on what Texas has done and how well it's working and start to develop their own plans. Certainly the 8 states involved in the 3 branch will be releasing similar plans soon. And now I will turn it back to Amy Harfeld to talk about what state advocates can do. Amy Harfeld, if you're there, you might still be on mute.
I'm sorry, I had to unmute myself. Okay, thank you, Amy. I'm assuming everybody can hear me. Yeah. So I hope I'm not repeating anything. We wanted to focus on what state advocates can do. Amy has mentioned that there has been a lot of activity at the federal and quite even more activity at the state and local level. And there are a lot of organizations and entities and networks that have been activated to help implement those recommendations. Frankly, nothing that the Commission did is binding, right? So none of these 114 recommendations are obligations for anyone to enact. And so all of this activity it's exciting because it helps keep kids safe and hopefully save lives, but it's also impressive because these are voluntary, proactive measures that have been taken to save lives. Now, in terms of the role of the Partnership for America's Children, what we have seen over the last year plus since the report came out is that there have been a lot of entities engaged in fatality prevention work that relate to the recommendations here and the work of the Commission generally. State legislatures have been engaged, and judges and a lot of networks. The state advocates haven't really been targeted and activated. And as I know, as a member of one of the members of the partnership, and somebody who works mostly on federal stuff but understands that states are really taking the lead these days in a lot of this work, you have a really unique and important role to play in pushing for some of the fatality prevention measures that you think are most important in your state. So we just wanted to highlight some of what's possible and to get you thinking and marinating on what the opportunities for action might be in the months ahead. And we sort of wanted to mention now that we are planning to do a follow-up webinar for this group once our report is released. So the report is going to, as Amy said, going to track and document all of the implementation efforts that we've seen over the local, county, state, and federal levels. Up to a certain point, we think the cutoff was June 1st. But there's an ongoing opportunity for us to learn about ongoing efforts. And after the report is out, we really want to work in a targeted way with you to identify what tools you might need to implement or advance some of these recommendations at the levels where you work. So, as you saw in a much earlier slide, the visual of the circle with the 3 areas, that's what this slide is discussing. So the recommendations really were falling into one of 3 categories: leadership, data, and multidisciplinary support. And this is where we really want to get you thinking about what you can do. What's happening in your state? What do you think? What do you need help getting moving? Who are the partners you might need to work with? So which recommendations do you believe are most needed and most viable in your state? Everybody's circumstances and legislature are different. What do you know of that's already underway relating to fatality prevention? And we really want to engage everyone. Amy pointed out that we're going to be releasing sort of a live website that is a visual representation of what's going to be in our report that's meant to be a living document that will be updated regularly as we learn about new implementation activities. And we're hoping that some of you might have news and information to put on to keep that map updated. So what activity do you already know about? What partners do you need to advance fatality prevention reforms in your jurisdiction? And what tools would be helpful in your advocacy? Do you need to hook, let's say you are in Wisconsin and you want to adopt a reform to your hotline that's similar to what Indiana did to make sure that all calls involving young children are responded to in a meaningful way and very quickly. So maybe you want to hook up with whoever was in charge of that program and speak to them about how they did it and what was involved. Or perhaps some model rules or model statutes would be useful in getting that advocacy going. So we're sort of wrapping up. We're ending here with a quote from David Sanders, who some of you know. He's at Casey Family Programs, and he served as the chair of the Commission to Eliminate Child Abuse and Neglect Fatalities. And I'm not going to read it out loud, but really we're going to take some questions and we have some closing polls. But I really want to leave you with some encouragement that, as depressing and disheartening as this issue is, really the most important thing the Commission concluded is that fatalities are preventable, and that many different entities and sectors have a hand in keeping kids safe. And certainly the partnership and all of the work, the amazing work that you do at the state level is a really critical factor in executing that. So I do want you to think about that, and let's move on, I think, to these polls.
Great. So let's take this first poll. I'm going to give you all a few moments to respond to it, and then we'll look at the results and move on to the second one. We do also have one question already, and I do want to remind you that you can type your question in the chat box, and then one of our two Amy's will respond to it. We have a pizza restaurant here in D.C. called the Two Amy's, so I try not to refer to the speakers as the Two Amy's. But okay, let's give you guys a moment or two more to answer this first poll, and then we'll look at the results on that.
That's encouraging.
Yeah, okay, it looks like we've got a bunch of responses here. Let's take a look at it. So it looks like 3/4 are aware of efforts to prevent child abuse and neglect fatalities in their jurisdictions, and a little under 1/4 are not. And then if we move on to our second poll, can you tell us whether you are involved in those efforts, if you're aware of them? Okay, I think we're probably up. A couple more. Yeah. All right, I think we're ready to look at these results, and the answers there are 60% of you are involved and 40% are not. I'm going to go over to the questions now, or actually, if one of you two want to comment on this, or do you want to take questions first? I guess we'll take questions.
I'm happy to take some questions.
Okay. We did have a question that's been withdrawn, but I'm going to give it to you anyway on the theory that you might have something you want to add to it. And that is, are you working with any local networks, county-based or regional, interested in implementing or advocating for these recommendations? You did have some local examples, but if you've got anything you want to add to that, that would be good to know.
Amy, I'd love to add a little bit if that's all right with you.
Yeah.
I mentioned Monterey County, California very briefly on the slide where Los Angeles and San Diego were pointed out. Monterey County has really exemplified so much of what the Commission called for in a public health approach. They decided after they experienced 2 fatalities of siblings about 1.5 years ago that they did not want to have this cycle of blame and shame, sort of typical approach that we see to fatalities across the country, that they were not going to fire anybody within their system, that instead they were going to reach out across the county and ask other agencies for help. And that's what they've done, and I've been a part of that, and I've been providing them with technical assistance about how to assess their readiness for what they called developing a roadmap to well-being. Monterey County also has the highest youth homicide rate in California. So they decided they didn't just want to write a fatality prevention plan, they wanted to write a violence prevention plan. And they've done that over the last year. They're starting to implement it now in their school system, their superintendent of schools, their chief of police, their health director, their substance use disorder treatment agencies have all played a really major role and have really lived this idea that child welfare is not in it alone, that it's everyone's responsibility to keep kids safe. And that's one example. If you're interested in knowing more, they published an article in the fall in the APHSA magazine, Policy and Practice, where they told more about their story for how they got the roadmap started.
Great.
And let me just add one thing to what Amy said. In the surveys that we sent out for information on what was happening across the country on implementation, in states that are county administered, we actually sent questionnaires out to the administrators of every county child welfare system. We tried to capture activity that's happening at the county level in all the states that are county administered. But I do want to make one additional plug that when the map that we previewed for you goes live, we are truly interested in capturing everything that's going on at every level. So if there are efforts happening at the county level or interest in doing stuff at the county level, there's an opportunity to reach out for information or assistance or to input information. So I can't say we're specifically engaged with a network of local groups, but to the extent that we're trying to reflect everything, we are interested in all of it.
Great, thank you. I'm not seeing any more questions here, so if you guys want to wrap up, and then we'll show them the contact information.
I would just say a couple words about the slide in front of you now. It was the Commission's mission to deliver a message of hope. They did not want to come at this issue with the same sort of shameful approach that we've taken to handling it in the past, and the one that the media often writes about when we read about fatalities in the news. They wanted people to understand that fatalities are preventable. The numbers can be almost twice as high as children who die from childhood cancers, but there's a role that we can all play, and hopefully that's a message that comes through in the report and also in the different types of implementation activities that we're tracking.
Great. Thank you, Amy Templeman. Amy Harfeld, do you have anything you want to add?
No, just thank you so much, Deb, for hosting us and giving us this opportunity to connect with your members. And thank you, all of the people that are on the phone, for all of the amazing work that you're doing. The state action is really where things are happening now. And so those of us who are working here in D.C. are eternally grateful for all of your hard work and dedication. And here is our contact information. If you have follow-up questions, please feel free to reach out to us after this webinar, and we look forward to hopefully part 2 of this once we have more information to share. And we'd love to hear from you in the meantime on any tools that might make this work more feasible for you in your jurisdictions.
And I don't think Amy Templeman mentioned this. She will be leaving her organization in a couple of weeks, but there will be someone taking her place. The same phone number will work, an email sent to her. That email address will either get to the person or have a responding notice that will let you know who to reach out to. So even if you can't reach Amy Templeman, the work will continue and you should reach out to them. Thank you all for joining us today. I hope this was helpful in your work. I will be circulating soon the slides, the recording, and any other materials that either Amy Harfeld or Amy Templeman would like me to include. And we would encourage you to feel free to share any of this with your colleagues in the States in pursuit of advancing your work. Have a great day. I'm going to end the recording now.